My name's Andrew Brown. I'm the Chief Pharmacist for Pharmacy Hive. And today I'd like to give you an overview of the Pharmacy Hive QSPP platform and show you how we can be a support partner to you in your pharmacy as you seek QSPP accreditation. In our time today, I'd like to go over what's changing, a mind shift that you'll have to move to in order to really understand and comply, what QSPP is requiring, and then give you an overview of our platform, as well as a deep dive into some of the components, and demonstrate to you the value that the QSPP platform can have for your business. QSPP is not simply a new way of accreditation that's just the same as the old with a name change. This requires a different mind shift. QSPP is measuring us against the Australian Community Pharmacy Standard, and this standard has this emphasis on quality, safety, clinical governance, and patient-centered care. But it's not simply an update to accreditation. It's not just changing the letters. It's a fundamental shift in how compliance is demonstrated in practice. And this is going to be a requirement for CPA programs, NDSS, and vaccination in some states, as well as some private programs for pharmacy. So the key mindset shift is going from documentation, so the tick and flick mentality, to demonstrated practice, ongoing demonstrated practice. This periodic compliance versus ongoing assurance that policies exist to demonstrating daily use and continuous quality improvement, and looking at customers not just as consumers, but as partners in their healthcare, in their journey. It's about showing, not just stating, that safe systems are in place, staff understand them, they're consistently applied, and customers are involved in their care and how their care is delivered. Perhaps things you're already doing in your practice, but things that you have to demonstrate with evidence. And this ongoing evidence really shows that there's real-time use of systems, that documented activities across the standards, and there is continuous quality improvement. And so we're moving away from audit preparation, the assessor's coming in a month, what do we need to do, to this continuous operational readiness, which is what our customers expect of us. Now, the core challenge in pharmacies is that we're good at doing our job, but we're not good at documenting and recording how we've done our job or what's happened. So our challenge is translating requirements into daily practice, avoiding duplication of systems, and capturing evidence efficiently in what is a very busy business. And in that context is maintaining consistency across all our staff. And this is where a lot of compliance systems fail, and they're not integrated into your practice and into systems. So this is where we introduce Pharmacy Hive's QSPP platform. This is designed by pharmacists who work in community pharmacy and have experience with quality systems over time. This is a fully integrated digital system. It's designed to implement, manage, and evidence QSPP requirements across the business, but it's not just a document library, it's an operational ecosystem that integrates with your workflows. And I'd like to introduce to you some of those components. So in QCPP, everyone was focused on the policies and procedures and the tools. Were they there? Were they present? And we got our ticks. But we want to take these policies and procedures and operationalize them into daily workflows. So we're aligning responsibilities, we're capturing evidence automatically, and we're supporting continuous review. So in this way, we're embedding QSPP into routine pharmacy practice and not as a separate compliance activity. And this is what the intention of the QSPP standard is. So the platform itself has a number of dimensions. Clinical governance is something you'll hear a lot about. It has a clinical governance documentation. It has implementation tools that help you to go from just the policy and the procedure to creating and documenting evidence. And we do this through digital workflows and registers, systematic and easy to roll out staff training and induction systems that use automated tools on smartphones, and quality improvement systems, completing that cycle of collecting information, reviewing that information, acting on it and improving our systems as a result of what we learn. And then we've also built into the platform communication task management tools that are integrated to help with workflows and to make some of the routine collection of information easy. Now, first of all, we think about governance documentation. This ensures that the pharmacy has structured, standardized governance systems. So clinical governance is the umbrella of QSPP, where we have defined roles and responsibilities across named individuals, and there's an overarching system of when these people meet, document quality review, and show continuous improvement based on information they're receiving from how the business is operating. Policies, we're all aware of policies. These define the governance expectations and outline those professional obligations and the legal requirements, while our procedures, which need to be adapted to local pharmacy needs, provide step-by-step instructions in order to get consistent and safe implementation. Probably the significant point of difference here is understanding the depth of clinical governance and demonstrating that that oversight exists and reviews are being undertaken. Operational support tools is this next component. We have templates, whether it's clinical governance, wikis for roles and accountability, guidance documents, how to do staff rostering in a way that helps you to visually show that you have the competence on the floor for the range of pharmacy services that you have in place. We have forms and reference tools, for example, evidence-based wikis, wikis for staff support tools as well. And these particular support tools help us with governance, risk management, consumer engagement, and workforce management, which are part of what we need to demonstrate with QSPP. And they really ensure that staff can apply these requirements in real time. It's not just a procedure or a policy in the folder or on the website. It's actually actioned, and these tools help make that happen. Checklists. All pharmacists love a checklist. And how these are important in QSPP is they help to standardize tasks, particularly around checking that procedures are being followed, checking that cleaning is being done, checking that the consulting room has everything it needs in order to provide that high level of service. Or it might be a compliance checklist, for example, the Safe Work Australia workplace premises checklist that we should be doing yearly. And this provides a visible proof that procedures are being followed and that over time this is happening and not just before the assessor comes. One of the significant improvements in QSPP, our platform, if you've been involved in QCPP platform that we have had previously, is we've upgraded our data collection systems. So there are dashboards and there are digital registers so that you can take that overall loop from data collection, for example, it might be a dispensary incident or feedback from a customer, you're recording that information, we're putting that information in a register to be reviewed, it can be reviewed, signed off, and there can be clear documentation about how that information was used to improve a procedure or something as part of the workflow within the pharmacy. There's also a process that we follow and that we support you to follow where these are continuously updated and there's traceable evidence to show where things have changed over time. Now, we have systems set up that you can follow, but these can be aligned to your preferred audit-ready structures as well. We have digital enablement tools. Pharmacy Hive is integrated with smartphone usage, so we can use smartphone usage for staff in order to do training, for staff to do checklists, and this captures operational and clinical data in real time. You can even use a smartphone now in order to collect information about your fridge temperature if you haven't got a automatic data logger already. And we put these in to improve compliance and really capture data as part of the normal workflow. One of the other digital tools is a customer consulting tool where you can have on your phone the Pharmacy Hive app, have a discussion with your customer and link particular pieces of information or important facts that you want to email to the customer just as a follow-up to the conversation you're having. Again, easy to use in real time. The quality improvement framework is something that most pharmacies are familiar with. In the past, we've had reports we've received, either in paper version or using a digital tool. And in our QSPP offering, we've got incident reporting, near-miss tracking, team feedback, and customer feedback. And we're looking at not only things that have gone wrong, but things we want to notice that could do improvement with. And we want to, again, go back to that cycle of recording, reviewing, making a change, and then documenting that improvement. So completing that improvement cycle. And this is done using a digital form process, either with our app or using scanners as part of a web browser in the dispensary, for example, for dispensary incidents. And so this demonstrates active safety management through the system, which is a core pillar of the community pharmacy standards. One of the other things that the standard points out for us is we have to be auditing our systems. Now, what that means is that we are actively following staff as they go through with our customers our procedures in order to see that the procedure is being followed, and we can document that. And we have an automated auditing system for that. The recommendation is that each of both the clinical and general procedures in the pharmacy is audited once a year. And this is a digital process where a senior staff member can walk staff, shadow staff through a particular procedure and document how well that procedure is going, points for improvement, and then that can be signed off and systems changed and improved. This links to the quality care system, the quality improvement system rather, and it's really focused on that auditing. Now, digital record management policies and procedures are dynamic and they need to change over time. And the pharmacy Hive quality and safety system, our platform, allows you to document the historical changes, who makes them and when, and you can refer back to those changes and use them to demonstrate what's happening in your pharmacy over time in relation to digital record management. It looks at governance, staffing, and equipment, and it eliminates fragmented storage system. The QSPP platform basically has a home for all of your documentation associated with pharmacy, and you can do that in a secure environment. The pharmacy platform, the QSPP platform, is housed on digital servers through Amazon, but based in Australia using the current state-of-the-art secured system. And all of your staff can access this system, and you can lock it down by page in terms of which staff you would like to have what roles as part of the overall QSPP platform and its operation, so that it can be utilized by all staff and generating that information and keeping that quality of service through day-to-day activity. One of the other components is we have staff training and capability. For staff training, we have a learning management system that will have 30-minute modules to do with over-the-counter interactions that incorporate S2 and S3 refresher. We have a clinical overview looking at the symptoms, so looking at the questions to ask, looking at when to refer. We focus on the top pharmacy medicines by category. And then we finish off with a counselling, referral, and integration of loyalty program as part of the training. What's interesting is that these trainings can form the basis of your QSPP refresher for staff, which is going to be 3 hours a year. You can also use it, combine it with our tasking function to have seasonal training to try and boost sales and staff confidence with particular ailments coming up by season. And that's an added value. So again, demonstrating that we're not looking at a system here that's simply to get you accredited with QSPP, but it's a system that does that, but helps you improve your systems and business performance. We also have ongoing competency tracking that's linked with performance reviews, where you can observe and document competency of staff over time. One of the key components here is, depending on what pharmacy services you're offering, in the new leveled environment, you have to be able to demonstrate that the pharmacists that you have for doing those services meet the requirements in terms of their competency. Relating to staff, we also have a staff induction process. All of you will be aware of the the tiresome nature of getting staff to review policies and procedures in a manual or some other way as they come on board with you. But we also know the importance of that. So the staff induction process we've integrated into QSPP platform is an automated way where staff can review policies, ask questions about those policies, and then sign off. And also we have a guided process that we help you lead through so that your staff can buddy with other staff in order to see procedures in practice and sign off that they understand and are able to move forward with that role-specific activity. And so this shows and demonstrates that, which is, again, a great feature of this system. Communication and workflows are also important, and I've emphasized through this presentation the importance of those linkages. We have Buzz, which is like a team communication tool that is internal. A lot of pharmacies use WhatsApp, but we have a Buzz where you can share updates, reinforce safety culture, or just do reminders, really. And then we have activities calendar, where you can have that as a source of truth in terms of what's happening across the pharmacy, whether it's scheduling meetings or planning audits, or you've got a particular promotion that's coming up. This can all be documented on the calendar, and you can have all staff able to see that particular calendar to keep up to date. Well, another function we have is tasking function. So this tasking function you can set up and automate. It has a digital dashboard. Think of tasking in terms of those regular and routine activities that you always forget that you need people to do for you. For example, pharmacists each year need to load up their registration, their insurance, their first aid certificate, and if they're a vaccinating pharmacist, their anaphylaxis certificate. And you can automate a task, and you can give access to the pharmacist to the one page in their staff file where they can upload that material. You can also use tasking for doing things like your annual fridge calibration or other equipment safety checks that might be required. And these things you can build in the system to save time and to provide evidence that you're actually doing those activities. And on the right here, you can see there's a bit of a dashboard that will just tell you where things are. It's a traffic lighted system so that you can task someone with watching the dashboard in order to see if people need to be chased up in order to finish some of their activities. So if we bring all this together, we, through Pharmacy Hive and the QSPP platform, want to work with you to help you with your governance, moving from policy to procedures to tools, to creating evidence that you're providing quality and safe services to your customers, and then how you're demonstrating you're adding that quality review with continually improves the systems you're operating, not only for the benefit of your patients, but also improvement of your business bottom line. So this overall approach is fully integrated, gives you that continuous compliance model and real-time evidence. And this is what it's going to look like. This is a render of our pharmacy platform. It's going to be a QSPP, a little typo there that says QCPP, but we're in the process of building it. This platform will be available for July, and we would be encouraging pharmacies to move across to this platform as soon as is practical. This is another couple of shots. On the left here is the task dashboard that shows tasks under sort of audits, customer and community tasks, and staff tasks that can be monitored using a traffic light system. And on the right is an overview of the file structure in the main heart or the hive of the QSPP platform that will be recording and holding the information that you're gathering over time so that you can quickly demonstrate where you're up to with auditors, but also as owners and managers want to find and source information. That will be there as well. So overall, partnering with us and using the QSPP platform really helps you to streamline QSPP compliance, reduce duplication and improve workflow. And really it helps to strengthen that quality and safety element. And it's not only preparing you for when you're going to be assessed, but you will always be assessment ready. But in addition to that, you'll be confident confident of providing that ongoing quality service to your customers, but having the evidence to show others that you're doing that. Always assessment ready, delivering consistent care and driving quality improvement, but not forgetting that we're doing this to not just serve the customers, but to improve the bottom line of the business. QSPP is a significant step forward for community pharmacy. We're embracing it, and we want to work with you to make your QSPP accreditation a reality, but also to help you see the business improvements you can have by working more efficiently, and help to embed those into your practice. We'd like to invite you to scan here and register your interest. We'd love to talk to you one-on-one, give you a demonstration of our QSPP platform, and we hope that you would be able to contact us, and we look forward to working with you as we help you meet your QSPP goals. Thank you very much for your time today.